white blood corpuscles, that is leukocytes. They are colorless, nucleated and amoeboid cells larger than RBCs. Due to their amoeboid movement, they can move out of the capillary walls by a process called diapedesis. So diapedesis means WBCs, because of amoeboid movement, can move out of the capillary walls. A normal adult has an average 5,000 to 11,000 WBCs per millimeter cube of blood. Decrease in WBCs, that is less than 4,000, is called leukopenia. So leukopenia means decrease in WBCs less than 4,000. It is common in HIV, AIDS and TB patients or those exposed to radiations, shocks, etc. Temporary increase in number of WBCs is called leukocytosis. So leukocytosis means temporary increase in number of WBCs. It is due to infection. It occurs during pregnancy and in newborn babies. Uncontrolled increase in number of WBCs is a type of blood cancer called leukemia. So uncontrolled increase in number of WBCs is a blood cancer called leukemia. WBCs are mainly concerned with defense mechanism, that is protection. It shows polymorphism. They exist in variable forms. They can be classified into two main types such as granulocyte and agranulocyte. Let's see granulocyte. These are WBCs with a granular cytoplasm. Means granules are present in the cytoplasm and they are called polymorphonuclear leukocyte, PMN cells. They have lobulated nuclei in different shapes. Granulocytes are formed from myeloid stem cell and once formed do not divide. Granulocytes constitute about 72% of total WBC. Granules are actually secreted vesicles which contains various secretions, enzyme, etc. Depending upon staining property of the granules, these granulocytes are classified into three types such as Neutrophil, Basophil and Acidophil. Neutrophil granules are very fine, large in number, evenly distributed and stained with neutral stain dye. So neutrophil stained with neutral stain dye. Neutrophils are about 70% of total WBCs. These cells are spherical and nucleus is several lobed, 2 to 7. So in neutrophil, nucleus is several lobed, 2 to 7. These are able to perform amoeboid movement and phagocytosis. They are responsible for destroying pathogens by the process of phagocytosis. Pus is mixture of dead neutrophil, damaged tissue and dead microbes. Basophil, that is cyanophil. This cell have very few granules of large size and stained with basic stain like methylene blue. Basophil are non-phagocytic, small, spherical cells and are about 0.5 to 1% of total WBC. Nucleus is twisted. So note over here, in Basophil, nucleus is twisted. They are present in infected and allergic conditions only. Basophil secrete heparin, histamine and serotonin. Eosinophil, that is Acidophil, contains lysosomal granules that are stained to red color with acidic stain like eosine. Eosinophil are about 1 to 3% of total WBC. Nucleus is bilobed. So in eosinophil, nucleus is bilobed and they stain by acetic dye eosine. They destroy antigen-antibody complex by phagocytosis. Their number increased in allergic conditions and they show antihistaminic property. They are also responsible for detoxification as they produce antitoxin. Agranulocyte. They are about 28% of total WBCs. Cytoplasm of this leukocyte is without granule. Means in agranulocyte, granules are absent. They are formed from lymphoid stem cells and can divide by mitosis. Nuclei of agranulocyte are large in size but are not lobulated like granulocyte. They are of two types, lymphocyte and monocyte. Lymphocyte are the smallest of all WBC and have a large spherical nucleus. They constitute about 25 to 30% of total WBC. Depending upon function, two types of lymphocyte are present as B lymphocyte and T lymphocyte. B lymphocyte mature in bone marrow and are responsible for antibody production, humoral immunity. It is highly specific antigen-antibody immunity. T lymphocyte mature in thymus and are responsible for cell-mediated immunity. Helper T cell, killer T cell, mammary T cell and suppressor T cell are the four main subtypes of T lymphocyte. Monocyte are the largest of all WBC. Its nucleus is large and bean or kidney shaped. They form 3 to 5% of WBCs. Monocytes are actively motile and give rise to macrophages. They are mainly phagocytic and destroy the bacteria and dead or damaged tissue by phagocytosis.